So hello everyone, welcome to my new video. So today in this video, I will discuss with you all about a very important topic that you all should know and all should have a basic idea about this thing. So I'm talking about corneal transplantation. Okay, so let's start. So here this corneal transplantation, which is also known as corneal grafting or keratoplasty, is a surgical procedure which is used to replace a healthy donor cornea. So there are several types of corneal transplantation techniques, each suited to specific condition and patient need. So there are various types of corneal transplantation, but in this video, I will only discuss on penetrating keratoplasty, and in the next consecutive videos, I will discuss on other type of corneal transplantation. Okay. So this is penetrating keratoplasty. So penetrating keratoplasty or optical penetrating keratoplasty is a technique of performing full thickness corneal transplantation where the diseased cornea is removed and replaced with a healthy and viable donor cornea, that is penetrating keratoplasty. So here, these are the types of penetrating keratoplasty. This is tectonic PK, therapeutic PK, cosmetic PK, and optical PK. So what is tectonic PK? So this tectonic PK, it is used to restore the anatomical integrity of the globe. Therapeutic penetrating keratoplasty, so it is used to eliminate the infective load of the eye. Okay, so here cosmetic PK, so or cosmetic penetrating keratoplasty. So keratoplasty is done to remove the corneal opacity, like what is it, corneal degeneration, all such things. And optical penetrating keratoplasty, here keratoplasty is done to restore the vision. That is optical penetrating keratoplasty. Okay. So here, these are the common indication for keratoplasty. So here you can see aphakic bullous keratopathy, pseudophakic bullous keratopathy, traumatic corneal ulcer, scar post-infective keratitis, corneal degeneration, stromal dystrophy, endothelial dystrophy, advanced keratoconus. In all such cases, keratoplasty is one option. So these are the indication based on prognostic outcome. So here there is the outcome. How much? How will be the outcome of the penetrating keratoplasty? Depending on that, it is categorized in four types. Category one, two, three, four. So let's start from the category one. So category one means here the prognosis will be very much high and 90% success rate will be there in category one cases. Like if I give you the examples like keratoconus, corneal dystrophy, lattice granular dystrophy, Fuchs dystrophy, or early stages of Fuchs dystrophy, in such cases, if the patient underwent keratoplasty, then the visual outcome or surgical outcome is very high. It is up to 90%. Okay. But in category two, so here it is also quite very much successful, but it is not more than 90% success rate here, but it is in between 80 to 90% success rate. So this category two penetrating keratoplasty, it includes cases like pseudophakic bullous keratopathy, aphakic bullous keratopathy, Fuchs dystrophy, macular corneal dystrophy, interstitial keratitis or herpetic keratitis. All such cases are included in category 2, where a visual outcome is in between or surgical outcome is in between 80 to 90%. And here, category 3, so here the surgical outcome is not that much good. Okay, as category 1 and 2. So here, surgical outcome will be, or the prognosis will be in between 50 to 80%. So here, cases include like keratoglobus, pellucid marginal corneal degeneration, active keratitis or corneal perforation, congenital hereditary endothelial dystrophy, or mild grade of dry eye or mild grade of chemical injury. All such cases, if the patient underwent what to say penetrating keratoplasty, then the visual outcome or the surgical outcome will not be that much good. So depending on these cases, you have to instruct the patient that how much will be the surgical outcome, so that in post-operative cases, the patient is already know that how much will be the outcome. Okay, and if in category 4, this is the last category, so it is here the prognosis is less than 50% success rate. So here you will definitely need to instruct the patient that you are not doing this surgery for visual outcome and visual recovery, but to save the eye that you are doing this surgery, something, so that the patient is mentally prepared about these cases. So here the cases include like ocular pemphigoid or Sjogren syndrome, Steven-Johnson syndrome, congenital glaucoma, anterior chamber cleavage syndrome, multiple graft failure already done, or neuroparalytic disease or neurotropic keratitis. All such cases, the surgical outcome will be not that much good. So it is in between. Uh, or in less than 50%. This is category 4. So category 1, if the case is in the under category 1, it will give the best prognosis. Okay, that is more than 90% success rate is there. But if the case is like ocular pemphigoid, Steven Johnson syndrome, or congenital glaucoma cases where it is quite risky type of cases, so here the surgical outcome is not that much good here. Okay. So here, these are the contraindications of pending keratoplasty. That means here, in this kind of cases, you will see certain complications even after underwent surgery. Something like if the patient having severe dry eye, Steven Johnson syndrome, toxic epidermal necrolysis, or advanced ocular surface disease, anterior staphyloma, retinal detachment, blepharitis, meibomian gland dysfunction, acute conjunctivitis, episcleritis or scleritis. So these are the cases here the surgical outcome will not be that much good. So these are the contraindication where if even after that you did PK, the outcome will be very bad if the patient have these conditions. Okay. So let's discuss how this surgery actually perform. Okay. So first of all, preparation. So the patient underwent a complete comprehensive eye examination to assess the condition of the cornea and overall health. And the donor cornea is also carefully evaluated in slit lamp to ensure the suitability of suitability for the transplantation. Okay. Now, after that, in the OT, anesthesia is given. So here, local or general anesthesia is administered to ensure the patient comfort during the procedure. So removal of the corneal tissue. So here, this is how corneal tissue is removing, where this instrument is known as trephine. Okay, so it is trephine. So using a trephine, it is a circular cutting instrument, and the surgeon remove the circular section of the patient disease or damaged cornea, and the size of the trephine is matched to the size of the donor cornea also. Okay, here the donor cornea uh, preparation. So here the donor cornea that is obtained from the eye bank is also trephied to match the size of the recipient corneal opening. Okay, so here the graft placement is there. So the donor cornea is carefully placed onto the recipient eye and secured in position using fine sutures. The switchers may be either interrupted or continuous, so depending on the surgeon preferences. So here you can see switchers are continuous. Okay, so here switcher tension of the switcher is adjusted to ensure the proper alignment and suitability of the graft. So this step is crucial for optimizing the visual outcome. And after that, closure and post-operative care. So here the surgical site is carefully inspected for any leak or irregularities, and the eye is typically patched to protect it during the initial healing periods. The patient are prescribed medication to prevent infection and reduce inflammation and promote healing. So here you need to call the patient in follow-up manner. So regular follow-up visit are scheduled to monitor the progress of healing and assess the visual acuity, adjust medication as needed. So switchers may be gradually removed over time depending on the patient response to the treatment. So this penetrating keratoplasty effectively restore vision and alleviate symptoms associated with corneal disease such as keratoconus, corneal scraping, or corneal dystrophy. However, it is important to note that the success of the procedure depend on the various factors, including the underlying condition being treated and the patient overall eye health. So there additions to post-operative care instructions. So that's why you need to give proper instruction to the patient and explain that in which category the patient is in and what can be the surgical outcome, so that the patient is already mentally prepared for such outcomes. Okay. So that's all, friends. Thanks for watching. And please don't forget to like my video, subscribe to my channel. I hope this video helped you a lot to understand quite more about penetrating keratoplasty. So in the next videos, I will upload on other type of corneal transplant.